Sir, good afternoon.
Hello.
My name is Deanne, and I'm a registered nurse and a constituent in your district. Thank you for taking the time to meet with me today.
Sure.
I'm here to advocate for your support regarding expanding scope of practice boundaries for nurse practitioners and allowing them to practice to their full extent of training and education. I'm not sure if you are aware, but Senator Ed Hernandez, the chairperson of the Senate Health Committee, is leading an effort to expand professional boundaries without restrictions. This includes allowing nurse practitioners to provide primary care, including diagnosis and treatment, without physician oversight. I would like to encourage you to support Senator Hernandez in his efforts to pass this bill once it's introduced into legislation.
Well, why do you feel that we need to expand the boundaries for nurse practitioners?
Sir, I'm glad you asked. Because of the Patient Protection and Affordable Care Act, every single person in this state will have health insurance. And as a result, there needs to be a major redesign to increase the capacity of primary care providers and meet the demand. By 2020, the United States will face a shortage of 45,000 primary care physicians. It is unlikely that the scarce supply of primary care physicians will meet the demand. In addition, the number of nurse practitioners is expected to double by 2025.
Why do you think nurse practitioners can fill this void?
Nurse practitioners are trained through a rigorous educational program to practice independently and deliver primary care. All nurse practitioners must pass a national board certification exam in the area of specialty to qualify for licensing in their state. For over 5 decades, nurse practitioners have been utilized to deliver primary care in the underserved areas and vulnerable populations. I would also like to share with you a brief I prepared that outlines some of the outcomes expected if nurse practitioners are able to practice to their full extent of training. Some of these outcomes include increased access to primary care in diverse settings, improved quality care due to the distinct knowledge and skills of nurse practitioners. One study done by RAND showed that nurse practitioners could reduce $4.2 to $8.4 billion over 10 years if nurse practitioners had expanded boundaries in just one state of Massachusetts.
Can you tell me who would be opposed to this legislation?
Thank you for asking. Because the proposed changes would change the medical establishment, turf wars could ensue that could contribute to the failure of the Affordable Care Act in California. Physicians have concern regarding the lack of educational and training of nurse practitioners as compared to physicians. But if there's not enough primary care physicians, you could have access with health insurance but not access to care. Currently, just 18 of the 58 counties in California have the federal government recommended supply of physicians. In addition, nearly 30% of these physicians are expected to retire, the highest in the nation according to the Association of American Medical Colleges. Do you have any questions?
No, very good, thank you.
I would like to again thank you for your time. This is not only something I value professionally, but personally as well. I would again like to remind you that I'm leaving you with this brief outlining what we have discussed. I'm also providing my contact information. If you have any further questions, feel free to contact me.
Thank you for stopping in.
Thank you very much. Bye now.
Bye.